My name is Amal Nirgadkar. I'm the CEO of Patient Prism, and I'm delighted to welcome Dr. Len Tau, who's a friend of mine, into our studios. And if you haven't heard of Dr. Tau, you should know him because he's an extremely popular speaker at dental conferences nationwide. He's a practice consultant who helps dentists understand the importance of online reputation. He was named as one of Philadelphia's top dentists consistently for many, many years. He has one of the best reputations of any dentist you can find across the nation. So Dr. Tau, it's my pleasure to welcome you here. Thank you for coming.
Thank you for having me.
Absolutely. And my first question right off the bat to you is that you are known as the reputation doctor, right? And we know how important reputation is to get people in the door, and it helps you throughout the entire journey of the patient. So tell me why your online reputation is so important today.
Online reputation is so important really because it's the one thing that people look at first and foremost online. It's literally, and I say in my seminars, it's as important as someone's credit score. Whereas if somebody comes to my practice and need money,
yes,
we apply for care credit, and if they have good credit, they get it. So, right. I mean, that's the one determining factor in my practice to get someone money. Well, when people go online and they look you up, if you have bad reviews or no reviews, people simply aren't coming into your practice anymore. I mean, that's the single most important determining factor now, because it's the first thing people see when they look you up. Google promotes these reviews all over the place.
Right.
So it's so important because it literally is now the first and foremost thing that people are seeing online.
And have you noticed that are most patients, new patients, finding their dentist online? Is that a true statement?
That's a 100% true statement.
Okay.
Because, I mean, look, my dad is a dentist. He retired after 47 years.
Right.
When my dad, in his heyday, they said, "Who's your dentist?" Dr. Tau. They gave a phone number and they called.
Right.
That's the way people did it in the past.
Right.
Now, when they say, "Who's your dentist?" Dr. Tau, they go online, they look up Dr. Tau, and they look
right.
for reviews. They look at what review sites, and they read them and they check them out, and then they may pick up the phone and call.
Correct.
They don't do the normal sequence anymore. Even specialists. It's the specialists were referred by other doctors. Well, when they're referred, if I give my patient a card for the endodontist,
right.
what do you think they do? They take out their phone and they look up the endodontist online. They no longer do those other things anymore.
So it is very important to track and manage your online reputation.
Oh yeah, you have to.
And so what do you do, right? What do you do in terms of developing a strategy, in terms of getting your patients to rave about you online? Is it important to have a strategic and like a goal of like, hey, I want so many good reviews? Is that something that dentists should actively look at every week, every month?
So I look at my reviews every single day.
Okay.
I check, I see what's coming in. Obviously, I want to avoid a negative review if possible. Although sure. I believe that every practice should welcome those negative reviews only because it proves that a business is real.
Right.
So I want to look at my reviews. I want to see what people are saying about me. I want to scour the internet for anything I may miss.
Right.
I think it's really important to track them, to market them, to manage them. I mean, these are all things that people should be doing because, I mean, like I said, it is the one thing that is really being looked at almost every day by your patients.
And is it's almost like the reputation and the reviews are part of your brand now, right? It really is. If you don't have any reputation, or if you have, God forbid, a bad one, it diminishes your brand significantly. And then everything you do from a marketing standpoint, you could spend all this money on Google AdWords, get patients in the door, and then you've got no reputation or bad reputation, that patient's not going to call you.
Yeah, one of the most important slides during my presentation is a slide that says, hey, if you're doing Google AdWords,
right.
if you're doing SEO, if you're doing retargeting, if you're doing either free social media or even boosted social media, or no matter whatever you're spending your money on marketing-wise, if you don't have the reputation to support it,
right.
people aren't going to be coming in because you have no reputation or a bad reputation.
Right.
So basically, I don't want to say you're wasting your money, but you're not going to have the ROI to support the investment that you're making. And I always like to say that, marketing is an investment in your practice. It's
sure.
not just an expense.
Correct.
And you need to have ROI in it, or it's not going to be good. And that's the most important thing.
And the ROI is significantly diminished if you can get the patient to take the next step, which is call you. And what stops them in the tracks, right, is no reputation or a bad reputation.
Right. They may click on you.
Right.
They're going to click on the link, but then when they look it up and they say, they have 2.5 stars,
right.
I'm not coming in.
Right.
So.
And you do kind of you teach a course, right, on this. You're evaluating your online score. What's that course about?
So I give actually a number of courses. So one is called "Oh My God, I Got a Bad Review. What do I do?"
Okay.
So it's specifically dealing with how to handle a bad review.
That's fantastic.
I give a course on help on Yelp. So people, help. Yelp is like a death to a lot of practices. They don't understand how Yelp works. So I give a class on help on Yelp. I give a class on managing your online presence. It's a hands-on course. Everybody brings their computers,
Nice.
And they look at that. I give a class on how to create the raving patient, so just on reviews. And I give a class on the overall marketing from A to Z, how to take your practice to the top of a Google search, literally by doing everything online. And it covers Google AdWords, website design, social media, blogging. So, I give a lot of different courses on these topics.
But at the core of it, right, you can have the best looking website in the world. You can have the best promotions in the world, but if you don't have a good reputation or a great reputation, patients are not going to come to you.
Yeah, and when I started speaking 10 years ago now,
right.
When I was not into the reputation perspective like I am now,
Sure.
I still talked about reputation as being the core of what you need to be doing, because the ultimate determinant is going to be what your patients are saying about you. I always say that nobody believes what your marketing says. Patients or team members don't put bad reviews on your website.
Correct.
Correct. You don't promote your bad reviews.
Right.
So they don't believe, just like advertisers don't believe. The Crunchy Bell taco on an advertisement has a ton of beef in it. When you get it, it has barely any beef in it. So nobody believes the marketing because of that.
Right.
Like our photos are unbelievable as much, even though they're before and after photos. They can be doctored. You don't know that online.
Correct.
So they believe what your patients say about you online. Even if they're anonymous, it's still more believable, and that's what patients are determining to come into your practice.
It's a great point to end on as dentists, and whether you're a group practice or an individual practice, you have to actively look at your online reputation, as Dr. Tau says, every single day or every single week at least, and have a strategy, right? Have a strategy to spread the goodness that you have in your office to the public, because social proof at the end of the day is going to be one of the best tools for you to attract patients into your office. So thank you so much for the discussion.